anatomy on our donors. We show first the mid-sagittal line, which divides us into right and left halves. We show the jugular notch, which is at the superior border of the manubrium of the sternum. And we now show the sternal angle of Louis, where the manubrium and body of the sternum meet, and this union can be felt on your patients. It may be more difficult to feel on your donors. You should refer to a nearby skeleton to find this landmark. It is important because it is where the second rib articulates with the sternum. We now show the xiphoid process, and we show the costal margin, which is the lower margin of the ribs, and we see them meeting in the midline at the xiphisternal junction. We now show the pubic symphysis, also in the midline, and we show the transpyloric plane, which is roughly halfway between the jugular notch and the pubic symphysis. We now show the supracristal plane, or plane of the iliac crests, which is roughly at the level of the fourth lumbar vertebra. We also show the anterior superior spines and the plane that crosses them. We now show the inguinal ligament, which runs between the anterior superior spine and the pubic tubercles, which are just lateral to the pubic symphysis. We also indicate the subcostal plane across the inferior margin of the ribs. We show the midclavicular line. We see it passing approximately through the nipples. And we show the mid-axillary line. We see the dome of the diaphragm here. We note that on the right side the dome is more superior than on the left. We now summarize the structures which we've identified at this point. We now identify the surface markings of some important abdominal structures. We see here the gallbladder, approximately at the junction between the transpyloric plane and the midclavicular line, and it is deep to the ribs and can only be felt in an enlarged gallbladder. We see now the liver here, the large liver. We see it extends as far superiorly as the diaphragm and as far to the left as the nipple. We see the location now of a spleen tip in a person with a very enlarged spleen. It's at the location of about the 8th rib, close to the midclavicular line, and is deep to the rib cage. We show now the abdominal aorta. The aorta becomes the abdominal aorta as it passes through the aortic hiatus at about T12, and we've stopped drawing it here just inferior to the umbilicus. Just inferior to the umbilicus at about L4, the aorta divides into right and left common iliacs, which pass inferiorly and laterally to reach the inguinal ligaments at about their midpoint. The artery then passes deep to the inguinal ligaments to become the femoral artery. We note just inferior to the transpyloric plane, we identify the renal arteries. We now identify McBurney's point, which lies a third of the way from the anterior superior spine to the umbilicus, and this is where the appendix lies. We now summarize the abdominal structures which we've identified. We'll now identify some critical structures in the thorax. We show now the surface outline of the heart. We see the right border of the heart is close to the right border of the sternum, and the apex of the heart is close to the midclavicular line and near the nipple. The superior border of the heart is roughly at the level of the third rib. We show here now the aorta coursing off to the right, and we see it just to the right of the sternal angle, and then curving behind the manubrium to the left. We show also now the bifurcation of the trachea at the sternal angle. We see it dividing into its lobar bronchi, 3 on the right and 2 on the left. We see also the pulmonary trunk dividing into right and left pulmonary arteries that follow the bronchi as they go to supply the lungs. We now see the location of the valves of the heart. We see the pulmonary, aortic, mitral, and tricuspid valves coursing inferiorly and obliquely. We note here now the auscultation points for these valves, and note that the auscultation points follow roughly the direction of blood flow. We now show the lines of pleural reflection, which indicate the maximum extent of the pleural cavity, and we see that the pleural cavity extends superior to the medial third of the clavicle, and then they descend close to the midline on each side. On the right, the pleural cavity descends inferiorly and then curves to follow the costal margin. On the left, the pleural cavity extends inferiorly to about the third rib, where it deviates laterally because of the presence of the heart. And then once inferior to the heart, it follows the same trajectory as that of the right pleural cavity. We show here the position of the lungs themselves in quiet inspiration, where they have not filled the pleural cavity completely. And we note that they're a rib or two above the pleural cavity. We now summarize the structures of the thorax which we've drawn.